Hi, I'm Camilla Wishaw from Optum Equine. Regumate, ReadyServe, altrenogest, Altren and OvuMed are all synthetic forms of the hormone progesterone and are commonly used in mares and fillies to help suppress oestrus, and in doing so, used with the aim to help treat behavioural issues in susceptible fillies and mares, as well as with the aim to help maintain pregnancy in problem pregnancy mares. And while use of these drugs in horses warrants careful consideration, today's video is about the effects these drugs can have in humans. So scarily, altrenogest and the other synthetic forms of progesterone are routinely viewed as relatively harmless substances. Yet contact with them can cause significant health issues in both women and men. So contact with forms of altrenogest have been widely reported to the Food and Drug Administration, so the FDA, for harmful effects in both males and females. Contact with the drug can occur through the skin and is generally the mode that most people are affected by, but even wearing gloves when handling any form of synthetic progesterone doesn't protect us from the harmful effects, as the drug easily penetrates those gloves and can therefore then penetrate our skin. Quite alarmingly, even just coming in contact with surfaces that have residue of progesterone left on them, so bench tops, stable doors, barn surfaces, even residue left on treated horses, can have significant health consequences in humans. In females, contact with the drug is known to cause menstrual irregularities. In men, cases of reduced libido have been reported, and in both men and women, abdominal pain, nausea, diarrhea, and skin rashes have all occurred. Now, altrenogest can be a valuable tool in some cases, and in any situation, one of the first questions I ask is whether we're treating the underlying causes of the reproductive issue or the behavioural issue in the mare and filly, or are we simply trying to manage the outward clinical signs? The good news is that in many of these cases, there may be alternative options worth considering, depending on the individual horse and why the progesterone was prescribed in the first place.